Well, hey guys, in this video, we're going to be talking about 5 ways in which your face changes with age, and I'm going to be touching on procedures and interventions that can help in reversing some of these visible signs of age-related change to the face. Now, across my videos, the emphasis is always on skin health. I'm always talking about anti-aging for your skin, but when we're talking about our face as a whole, you have a lot more going on that experiences age-related wear and tear besides just your skin. You've got muscle, fat, ligaments, underlying connective tissue. One way in which your face changes with age is the appearance of your nose. The ligaments that attach your skin to the underlying cartilage of the nose weaken with time, and the end result of that is the tip of your nose actually starts to droop. Now, it's not as though age-related change happens exclusively to your nose and all at once. Remember, you have the rest of your face that is also experiencing age-related change. The face starts to kind of draw inward. The combination of that, along with the droop of the nasal tip, can almost make your nose appear wider. In some cases, the sides of the nose can collapse inward, and some people actually experience some breathing problems related to that. The skin of the nose experiences a lot of age-related change from cumulative sun exposure, including prominent blood vessels, which can be corrected with vascular lasers like pulse dye laser or KTP laser. The pores of the nose may appear more prominent with age. In terms of improving the skin on the nose, I already mentioned pulse dye laser for those blood vessels. You can have resurfacing laser treatments, can in some cases help improve the appearance of pores. But when we're talking about the structure of the nose and loss of those ligamentous attachments or the integrity of those, things like a thread lift can actually help rejuvenate the nose. And in some cases, a little drop of filler can help with that nasal droop. With age, the eyes appear rounder, smaller. They appear as though they're losing the almond shape, and there are hollows under the eyes that start to become more prominent. This can give a look of being tired, less expressive, dark under eye circles. But the shape of your eyes doesn't actually change. It changes to your forehead, your eyelids, which start to droop, and your cheeks start to sag and flatten, and that ends up making the eyes look smaller and the hollows under the eyes and grooves more prominent. And you also have redistribution of fat in the face. That is a major contributing factor to volume loss and the appearance of aging in the face. Fat in our face is kind of sectioned into these discrete compartments as opposed to fat on the rest of our body. And those compartments of fat, they are independent of one another in terms of the rate of age-related change. And one place in which you begin to lose subcutaneous fat and volume is under the eyes, and that can lead to a very prominent nasojugal sulcus or a tear trough, and that can definitely make the eye look as though it has a dark under eye circle, and it can make you look very tired. Along with this, you have age-related accumulation of sun damage around the eyes that leads to wrinkles as a result of loss of collagen and elastin from cumulative sun exposure throughout your lifetime, and the skin is more prone to dryness, water loss. So continuing to use sun protection remains imperative, and it can actually help in improving some of the visible signs of skin aging around the eyes, along with wearing sunglasses. Using moisturizers around the eyes can also help in addressing the dryness and can visibly improve the look of fine lines and wrinkles. Retinols, like prescription tretinoin, in some cases are utilized around the eyes to improve collagen production and smooth out wrinkles and fine lines, and ultimately that may have an effect of brightening up dark under eye circles. Unfortunately, many do not tolerate topical retinoids around the eyes. It can be very irritating, and the skin there is quite thin, and that irritation can ultimately worsen the appearance of dryness and those fine wrinkles and lines. So it's a delicate balance, and for this reason, I always suggest people be very conservative with using retinoids that they buy over the counter, like a retinol serum around the eyes. I'm gonna link down below in the description box a retinol eye cream by Neutrogena that's quite good, but a basic moisturizer can go a long way in terms of just at least temporarily rejuvenating the look of tired under eyes. In terms of procedures, neurotoxins like Botox, they can help soften the pull of muscles that leads to wrinkles with motion. Strategic placement of filler may help in rejuvenating the under eye look, but unfortunately, filler in that area comes with more risk. And in some cases, use of a resurfacing laser to the skin around the eyes can help with eye bags under the eyes. Number 3 sign of aging to the face is actually loss of definition of your jaw. What happens is the muscles weaken in the neck and fat starts to migrate down into your neck, and so you lose definition in your jaw. You also have resorption of bone in what's called the mandible, and so you lose some of that sharp angle. Your chin can become more prominent appearing. You have less definition, maybe even the appearance of a double chin. The neck muscles also weaken and start to sag, and you can have what people not so kindly refer to as turkey neck. Some people may have quite a bit of accumulation of fat in that sagging tissue. And in some cases, a touch of liposuction may help, but it's not going to address the sagging that occurs with age-related weakening of the muscles and that ultimate sagging. In that case, you may be a candidate for a neck lift, which can help to tighten this area. For others, jaw implants can also help to rejuvenate the jawline as well. I mentioned earlier that with age, your eyes are going to appear smaller, but they're not actually changing. It's a result of change to other parts of your face. And your brow actually plays a role in the diminution of your eyes. Brows are held in a neutral position as a result of a dynamic interplay between nerves, muscles, and the underlying soft tissues. The uniform descent of the brows, not only does it contribute to making your eyes appear smaller and more sunken, but it kind of has a more heavy look. Neurotoxin is probably one of the most straightforward ways to correct that by weakening the muscles that contribute to pulling the brows downward. In some cases though, you may want to have a surgical brow lift that can actually lift the brows up. And number 5 is thinning of the lips, volume loss in your lips. This actually starts to show up around your 30s, just your lips are not as plump. Of course, you could pursue fillers for this if it was bothering you, but the shape and the size of the lips don't really start changing until maybe your 40s, even 50s, depending on your lifestyle habits up until that point. Around your 40s, you may start to notice vertical lip lines. This is obviously going to be even more early onset if you were a smoker. That definitely leads to these lip lines. But with age, those will appear. Beyond filler, resurfacing laser can help smooth out those fine lines and restore the look of a more youthful lip. And in some cases, it's really popular nowadays to have a little bit of neurotoxin placed in this area. It's called a lip flip, to help make the lips look fuller by addressing the muscles around the lips. That, of course, is not a permanent change, but it can result in the temporary, more youthful appearance of the lips. All right, so those are 5 ways in which your face is going to age that aren't just your skin. It's, you know, the muscles, the fat, the ligaments, I mean, the bone resorption, all of these things play a role in the appearance of hollows, downward migration of the brows, the loss of definition in the jawline. And of course, you can pursue aesthetic procedures to correct these, but really what is going to make the biggest difference in making this go more smoothly for you is honestly your lifestyle. I mean, don't fool yourself that there is some magic pill, some magic collagen supplement out there, or a, you know, set of facial exercises. Stop fooling yourself. These things happen, but it's your lifestyle factors that are gonna make the biggest difference in the extent of onset of these. If you smoke, it's gonna have a dramatic impact on how these changes appear. They're gonna appear more quickly and more noticeably. Eating a healthy, well-balanced diet that includes fruits and vegetables with micronutrients that can help facilitate collagen repair and proper healing with things like zinc. I mean, I've talked about many of these micronutrients in dedicated videos, so I'm not going to go into detail here, but that is so important. And sleep. Sleep is one of those things that I feel like sometimes I'm just talking to a wall. Well, I actually am talking to a wall. I know you guys appreciate the importance of sleep, but I feel like when people are tuning in to hear about strategies to prevent the signs of aging, sleep is one of those things where they're like, oh yeah, we'll get there. And when we get there, we'll handle it when we handle it. What are the serums? What are the toners? What are the procedures? What's hot? And really, honestly, if you can get 7 to 9 hours of sleep, if you can prioritize that, it's gonna make a huge difference. I am not kidding you guys. It really will make a huge difference, because that is when your body recovers from oxidative damage from environmental stressors. It's when collagen is repaired, and it helps with the inflammation levels in the body. And as far as your diet, not relying on processed sugary foods, drive-through foods, packaged crap. It really is important that we go back to a healthier diet. Alcohol has a tremendous impact on the onset of these changes as well. I think for some time now, alcohol has been promoted as, well, if you do it in moderation, it's actually helpful for you. And there's debate on whether or not that's true or not. I'm not saying it's not, but there is increasing evidence that alcohol is quite harmful to the body, even in small amounts. We know that it is actually a toxin. Hello, Gwyneth Paltrow. This is actually a toxin, alcohol, yes. But it definitely is inflammatory and gets in the way of proper healing, good quality sleep, and it can contribute to more prominent aging of the face, more severe, it generates more inflammation in the body that can accelerate bone loss and wrinkle formation. Again, these things that come about, you shouldn't fear them, but the rate at which they come about and the extent as they relate to your lifestyle, it is a clue that these things are impacting you internally as well. Another lifestyle factor that is so important is exercise. Now, I get questions from time to time about doing intensive cardiovascular exercise. Does it lead to more skin aging? I do think, actually, and I hesitate to say this because I don't want to discourage anyone from exercising, but I do think that in very intense long distance endurance athletes, they can, as a result of it being involved in very intense endurance sports for so long, I do think it does have a very catabolic effect on the body that can result in more obvious signs of skin aging. Now, to what extent some of that is also attributed to the fact that they may be participating in endurance sport outdoors, getting a lot of UV exposure, or the catabolic nature of that type of sport that can accelerate the rate of volume loss in the face. Truthfully, there's not a ton of good data on that, but there is a little bit to suggest that people who engage in endurance sport, we're talking, ultra marathon runners and things like that, not the average American sitting on the couch, occasionally entertaining the idea of doing some aerobic exercise. We're not talking about that. So it is definitely an extreme end of things, but you can't underestimate in the big picture of things how important movement and daily activity is to your health, including the rate of onset of skin aging. So to answer that question, is there a point at which things like running ends up being pro skin aging, making the visible signs of aging come on faster? I think that there probably is. So I would imagine, and this again is just theoretical, that yes, being involved in that type of intense exercise likely can play a role in kind of accelerating age-related volume loss in the face. But to the everyday person out there, by and large, you need to get moving, and that will help out your overall health by lowering inflammation. This is what you need to be focusing on. Get moving, eat well, sleep well, don't binge drink, don't smoke. These things, they seem so blah, blah, blah basic, but truthfully, they make the biggest difference in things that you can control, not only for how your skin and face change with age, but how long you are here on this planet. These changes that I mentioned to the aging face, personally, I don't perceive them as negatives. And it's just really, I think, an interesting thing to learn about and to share with you guys, because if you look at photographs of people through time, their face does change. And now that people undergo so many different types of minimally invasive procedures to enhance or change their appearance, people are always asking questions like, your face looks different. Did you have this done? Did this happen here? But truthfully, if you do nothing to your face in terms of filler, Botox, any kind of procedures, your face is going to change the way it looks. Yeah, I mean, your face will change with age. It's not necessarily a bad thing, but I think it's just interesting to realize that and to understand how our face changes. So those are 5 ways in which our face changes with age. I hope you all enjoyed this video. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.